Hi, this is Michele Downey, and I wanted to talk about a topic that is most misunderstood and very important to understand, and that is this topic of addiction. Now, the formal different definitions, there's many of them out there. This was defined by Dr. Ann Wilson Schaaf, who said, an addiction is any process or substance that has taken over our lives and over which we are powerless. They may or may not be physiological. It begins to have control over us in such a way that we feel we must be dishonest with others and ourselves. But it leads to increasing compulsiveness in our behavior. Anything we feel we have to lie about, something we're not willing to give up in order for our lives to be fuller and healthier. Another way to put it is, an addiction's purpose is to put a buffer between us and our awareness or feelings. It serves to numb us. There is no energy or awareness of other aspects of our lives. And an addict is a person who is powerless over a substance or a process in his or her life to the point that progressive immersion in the addiction will lead to death. All addictions are fatal, although addictions are also the only disease for which recovery is guaranteed if the person addicted begins a program of recovery. For further definition, an adult child of an alcoholic, or ASUA or ACA, is an adult child of an alcoholic who grew up in a family in which one or more parents was an alcoholic, or in a family that repeats alcoholic or addictive patterns. Adult children may not be addicts themselves as adults, although they can be. They carry a unique set of emotional problem and specific personality disorders that affect their lives. A codependent is anyone who has had an alcoholic parent or grandparent, is in a marriage or a love relationship with an alcoholic or another addict, or who came from an emotionally repressive family. A codependent is over 96% of our population in the U.S. 15% is a low estimate of the U.S. ACA population, and addiction is the norm for our society. Dr. Ann Wilson Schaaf divided addictions into two separate categories, one called substance and one called process. Substance addictions are the kind we normally think. They're ingestive, some of which leads to physical dependence. Whatever you put in your mouth. Drugs, alcohol, pills, mood-altering chemicals, some of which leads to physical dependence, such as alcohol, drugs, caffeine, nicotine, salt, sugar, and food. And the eating disorders are anorexia, bulimia, and compulsive overeating. Now, the process addictions are the kind that our culture rewards well. Work addictions, gambling, shopping addictions, sex addictions, which include internet pornography, internet addictions, love addictions, which you can call people addictions or codependency addictions, money addictions, certain types of thinking, even worry can be addictive, and religious addictions. Now again, addiction's main purpose and function is to put a buffer between us and our awareness of our feelings. Not bad people trying to get good, but sick people trying to get well. In the early days of alcohol treatment in the hospitals, of which I worked in one of the very first treatment centers called the Care Unit in Albuquerque, New Mexico, they divided things up and gave us some very interesting information, which I think is still true today. First of all, let's define chemical. When we used to give our lectures, we said any mood or mind-altering chemical, which could be alcohol, drugs, or pills. And let's pretend we throw everybody into three brackets: the experimental bracket, the social use bracket, and the social abuse bracket. You would agree 90% of our population has had a drink a drug or a pill at some point in their life. And 50 to 80% is a conservative number when you look at the alcohol, drugs, or pills that people have done in a social setting. You drank at a cocktail party, you passed a joint at a college party, that would count. And finally, social abuse is any bad or adverse thing that happens directly or indirectly as a result of the use of chemicals in any of these four areas: legal, job, relationship, or health. Legal, somebody gets a 502 or a DUI. Job, somebody shows up late on Monday with a hangover, or they don't even show up. Or school, somebody's making straight A's, then they're smoking pot, now they're making F's and they flunk out of school. Relationship, somebody says, I think you have a problem. No, I don't. Yes, I do. And those kind of fights. Or somebody under the influence of the chemical gets pregnant. And health, you snort too much cocaine, you get a nosebleed, you drink too much, and you throw up. So in any of those four categories, one time in your lifetime, I would imagine easily 25% of our population falls into that category. By the way, that does not mean that you're chemically dependent or addicted. So when we started looking at chemical dependency, we started to try to define it. And we said it was a physical allergy, a mental obsession, and because somebody violates their own values or their own spirit, we called it a spiritual disease. And we used to call it the X factor. What made somebody addicted or chemically dependent? And back in those days, we called it the X factor. Of course, we have 30 years of research since then, which I'll try to cram into this instructional video. So in order to be labeled a dis-ease, a disease, we have to define early, middle, late stages. There has to be a progression. There has to be a treatment or a cure. There has to be some identifiable aspects. And one of the questions I had, well, how do you know if you're just experimenting in social use or just even social abuse? Or how do you know when you have this X factor? Does it have to do with your age or what you use or how much you use? Which, of course, it didn't. So these are the things we have found over the last 30 years about this X factor and chemical dependency. The first thing we used to see, it ran in families, but we couldn't prove it until Dr. Mark Shuckett at the UCSD VA hospital proved it by his international research. He found a genetic predisposition, for example, 4 times higher in boys, 2 times higher in girls. And the problem, of course, it takes 30 years to do what they call a longitudinal research study. Now he's studying male adult children of alcoholics currently, and I saw him at the 15-year mark. And they're finding male adult children of alcoholics who've never ingested alcohol, that when at the age of 30 they ingest alcohol for the first time, their body assimilates it differently. It does something different. They're studying what that is. They don't know what it is, but they do know that there is something physiologically that happens that's different. Then in 1988, there was an Indiana biochemist who made the cover of Newsweek magazine because he not only found that chemically dependent people were missing certain liver enzymes, but he found racial connections. So, for example, high incidence of alcoholic addict populations, which would be your Irish, your American Indian, and your Eskimo, the latter two are anthropologically related. They do not have this liver enzyme, whereas Japanese and Jewish populations, mainly, who of course have low incidence of alcoholic addict populations, they have an extra liver enzyme that breaks down the metabolites of the alcohol, creates a flush effect. So their face turns red, or there's a tingling of the teeth, a numbing of the gums. There's something physiologically, innately, after 1 or 2 drinks, they say, I don't feel so good, I'm sleepy, I don't want any more, But people who belong to the Irish American Indian Eskimo alcoholic X factor population, they miss this liver enzyme. There's nothing to break down the metabolites of the alcohol. So there it goes right into the bloodstream, and they go, this is good, let's have some more. Then recently they found there was different chromosomes. There's a 10, a 9, and a 13. And for example, if you have a chromosome 10 and you're in the social abuse bracket, you will have a type of binge alcoholism. And it doesn't matter what age you are, which basically means you drink a lot in a short period of time and then can quit for a while. Then this woman, Dr. Virginia Davis at the University of Texas at Austin, was doing nothing with chemical dependency or addiction, but she was studying cancers in brains. And we all have thinking substances in our brains, but it is not common to have the substance THIQ. And she was noticing all of her cadavers had THIQ substance in their brains, and she couldn't figure out what was going on until she figured out that down the alley was Skid Row, and that was where they were getting their John and Jane Doe donations for the cadavers. In other words, late-stage alcoholic addicts. And so she found out there was a definite thinking substance that is found. And of course, the brains are found to be quite different. So anyway, there's many things that probably are going to even be found today that are involved in this X factor. One thing's for sure, you don't get to pick it. It's like blue eyes or brown eyes. You either have it or you don't. So in the stages of the disease, there are early, middle, and late stages. And I get a lot of parents that bring their teenagers to me, and is my 15-year-old an addict and alcoholic? And unless they have all 10 things I look for to diagnose them, I say, well, anybody in your history, any in your genetics, that kind of thing. But if they have 5 out of 10, I can't say, yeah, you for sure have an addict alcoholic on your hands. Your kid could be experimentally using and socially using and totally outgrow it. Or your kid could have the X factor and begin the early, middle, and late stage of this chronic, terminal, and progressive disease. So my suggestion back then, in those days, was to track over the next 2 years through urine, blood, saliva, some testing mechanism. And if they were alcoholic or addict, they eventually would pick up again. And that was the way that we started to work on that. But the truth of the matter is, you virtually cannot tell an early stage chemically dependent addict person from a regular person who's merely experimenting or in the social use. In fact, that's the reason there's a lot of people that out there are misdiagnosed and mistreated, is because to the untrained eye, these 2 stages are identical. And of course, most of our doctors, nurses, psychiatrists, health professionals, they're used to the DSM-5 Diagnostic Manual, which really describes the late stage. So how do you tell? Well, one thing is for sure. Once you are a pickle, you've crossed that magic line, you cannot return to be a cucumber. And it has nothing to do with age. Those crystal meth babies or fetal alcohol syndrome babies, they're born addicted. And of course, then there's people that can live till they're 80. And at that point, the disease takes over. And there's everything in between. So this is kind of a compilation of the early, middle, and late stages. And let's imagine that this person has the X factor. Usually the way we tell if somebody is an alcoholic addict is after they died. So let's take a person who is in his late stage at 60 years old, as on the right of the diagram. And this person died, let's say, of a heart attack. We know it was chemical dependency, but it doesn't say that on the death certificate. So we're going to go back in time and see what he did. So in the early stages, he did pot, like most kids. And then when he was 21, he said, pot's kid stuff. I want to join the fraternity. I'm going to drink alcohol. And so at 45, he starts having problems with alcohol. So he goes to the doctor, who gives him pills. Sleeping pills, Xanax, Atarax, one of those kind of pills that are addicting. So this is something that is the description of cross addiction. It does not matter the substance. The X factor doesn't care if you drink it, sniff it, huff it, puff it, whatever you do with it, it doesn't care. Once the X factor is activated, the mental, physical, and spiritual aspects of this disease are in motion. And as you can see, cross addiction, it doesn't matter whether it was heroin or meth or pills, they will either become addicted to the next substance of choice or they will return to their original chemical, which is quite confusing for people that are trying to treat these different substances. So another thing is called tolerance. And the best way to describe it is a story. And in this particular story, we'll take a man that's 25 years old whose father died from this disease at a young age. And he's basically in the middle stages. By the way, people in the early to middle stages can stop for long periods of time. It's only less than 2% or 5% that are, the skid row bums. Most people in the early to middle stages have jobs and families and go to school and actually are quite functional. So let's go back in time. He's 25, everybody says. And by the way, just for an example of what he's using and to explain the concept of tolerance, let's say on the weekends only, he does perhaps a 6-pack of beer, a glass of wine, just for the sample, a joint, a pill, and a line of crystal. And let's say his progression is very fast. 5 years later, which would be 30, his progression will be 1 case of beer, 1 bottle of wine, 3 joints, 3 pills, and a 1/4 gram of crystal a day. In other words, he has to do the same things, but a lot more to get the same effect. And that is what tolerance is. So let's go back in time at 25. And let's say he did not progress to what he would have had he been using and drinking at 30. Now, he says, get off my back. I'm going to prove to you I'm not an addict alcoholic like my dad. I'm not going to drink or use or do anything for 5 years. Now, at this point, he only had done a 6-pack of beer, a glass of wine, a joint, a pill, and a line of crystal. And let's just say he manages 5 full years of nothing. Now, remember, we're only dealing with the physical aspect of this disease. And we know he has the X factor. We have not addressed his mental or his spiritual disease. Most people call this the RIDS, the restless, irritable, and discontent. Dry drunk, white-knuckling it. He didn't do anything. But the physical aspect was the only aspect that was dealt with, which unfortunately is what people think is the cure for addiction, is just to never use the chemical. So 5 years has passed. He's 30 years old now, and he says, see, I can drink like a gentleman. He picks up a drink. Within 1 week, 2 months, or 2 years, some variable thereof, based on his genetics, he will not only do what he remembered he was doing, which was a 6-pack of beer, a glass of wine, a joint, a pill, a line of crystal. he will end up doing what he would have had he been using those whole 5 years. The case of beer, the bottle of wine, 3 joints, 3 pills, and a quarter gram of crystal a day. That's why a lot of old-time AA or Narcotics Anonymous people go out and they die. It's because in their memory, they had stopped where they had left off. They have no idea the progression continued while they were clean. This science does not understand, but that's why we know it's physical. And that is an example of tolerance, and it's an example of cross-addiction. By the way, another thing a lot of people forget is, let's talk a little bit about pills. Let's pretend that, say, somebody was doing 3 pills and 3 glasses of wine, and that equals in your blood system a value of 6. Well, one day, it could be 5 years later, those pills and the alcohol will multiply in the body, and that will equal a value of 9, and let's say 8 is the overdose value. That's why Anna Nicole Smith, Heath Ledger, Michael Jackson, it wasn't on that day that they died that they were so stupid they did something different that they've been doing for years. It's that day their body multiplied instead of added. So, again, the addiction is the disease. It's primary. It has to be treated first. Dr. Mark Shuckett used to teach it's primary, chronic, progressive, and fatal. But the first thing, it's primary. And there's a lot of people who are in and out of doctor's offices and emergency rooms because the primary disease was never identified. They were in counseling forever. But because the primary disease was never treated, never identified, they never did get better. It's chronic over a period of time. They get worse, never better, although it looks like they may be getting better. And it is characterized by denial and relapse. Progressive gets worse, never better over time. And of course, cross-addiction really complicates things. Maybe instead of alcohol, they go to meth. Maybe instead of meth, they go to heroin. Or maybe they think they're getting better now that they're just doing pot. It is fatal. The ends are jails, institutions, and death, insanity or death, although not everybody gets a wet brain due to the alcohol. But the insanity is they're in and out of doctors, hospitals, institutions, counselors' offices. And that is the insane part of this disease. Now, this disease is treatable, but it is not curable. But there is a remission. And once that remission happens, only with complete abstinence from all mood and mind-altering chemicals and a program of recovery which addresses all 3 aspects of that disease, mind, body, and soul, then they can recover and go into remission. 12-step programs have a 90% recovery rate and have been doing so for 80 years. And is the only program that has that kind of a statistic for that length of time. So there are lots and lots of things to talk about, but that's kind of a general overview. You can call myself at 760-207-1067, get a free ebook and some free audios on this topic. Thank you for listening, and have a good day.